Documentation is a medical and medical legal importance. Currently, most documentation is done on an electronic platform. You may hear it called as an EPCR or a PCR or EHR. These abbreviations are now known as a electronic patient care record, a patient care record, or an electronic health record. In this case, on our video slide, we have our local EPCR or electronic patient care record through MedMedia. This is called our MSTAT charting. Those EMS professionals and students that have authority or authorization to enter and have your own name and password may do so only when allowed as part of class activities. There shall be no documentation within these EHRs or EPCRs or on the MSTAT unless told to do so by your primary instructor. Therefore, documentation as an EMS student will be done in a paper form. These handouts or AMNES report forms or paper-based patient care report forms will be given to you during your class. Please keep in mind that spelling and grammar are important. There are medical abbreviations that are approved and to be utilized within each system. Become familiarized with these abbreviations. When we are charting, during the portion of gathering information, we will know that there are certain areas of importance. Usually we gather demographics, names, addresses, phone numbers, birth dates, physicians or primary care providers' names. We'll also divulge information and try to accurately ascertain medical and health information, including medications, hospitalizations, surgeries, allergies. We'll also identify and document all the history of the present illness or injury. We'll also record vital signs and anything that we find on physical examination. We'll then document anything that we treated our patient with and the reassessment and evaluation post-treatment. In documenting, we may use a special format in which to write the narrative. Here we have 3 on our slide: SOAP, charted, and cheated. Your charted and cheated forms start off with chief complaint, history, allergies, and so forth. This acronym can be deciphered in your text or easily deciphered by going online. For our EMS classes, it is this instructor's preference that we use the SOAP format, in that S stands for the subjective information. This is information that the patient says to you. This is anything that an individual or bystander also says to you. If it is a direct statement, please put any and everything that was said in quotations and then address by whom in which it was said. Again, S is for subjective, things that are told to you or spoken. The next would be O, which stands for objective information. This is information that you can obviously observe. We would say look, listen, and feel. So anything we can identify through observation, auscultation, and palpation, to include vital signs such as heart rate, circulatory status, skin signs, respiratory rate, lung sounds, pulse oximetry, blood pressure, EKG, temperature, end tidal CO2, and pupils. A stands for what we assess the patient having and how did we continue to address that. Our addressing or treatment would fall under P, which is plan. And so, just to recap, S stands for anything that they tell us. For example, this individual complains of chest pain. O, this individual points to the area of the chest. On examination, we don't see any type of deformity or any type of injury. The chest is symmetrical. On our assessment, we may have put on an EKG or did some lung sounds, and then we would also identify those that the lung sounds may be clear or absent, or that the EKG was normal or was abnormal, and then what our plan was. If we thought this needed to be an ice pack per se given, or someone needed to have an IV, oxygen, and cardiac medications administered. So again, it is this instructor's preference for us to use the SOAP format in the narrative. We'll be practicing documentation. Please, if you have any questions on this SOAP format, to bring it up during our practice.